ઓકે, સ્ટાર્ટ કરી દઈએ.
Yes.
ઓકે.
Hello. Good afternoon, everyone. Myself, Jasmine Modi, and on behalf of Harijat College of Optometry, I would like to welcome by you all. It's my pleasure to be a moderator for this live session, starting with a brief introduction of our program, Soft Contact Lens Learn, Educate and Practice, which is initiative by Harijat College team, where contact lens related topics are discussed and interacted briefly. The session is live, so if you have any queries or doubts regarding to topic, you can write them down in the chat section. We will be discussing them after the presentation. Before starting the session, may I briefly introduce our today's presenter, Ms. Dhyani Bhadja. She is a third year student of Bachelor of Optometry from Harijat College of Optometry, Navsari, Gujarat. She will be presenting on case report of Toric contact lens. On behalf of Harijat College of Optometry, I welcome you, Dhyani. So, shall we start?
Yes, thank you, Jasmine, for this introduction. Hello, everybody. Good afternoon. As Jasmine has introduced myself, I'm Dhyani Bhadja, studying in third year at Harijat College of Optometry, and here I am taking presentation on case report of Toric soft contact lens, in which we will see one case and we will understand the management of the case. So I will try to provide detailed information about my topic under the guidance of respected neuroscience. So can I start? Hello. Can I start?
Yes, start Dhyani.
Hello.
Yes, start Dhyani. You can start now.
Okay, sir. This is the demographic data of the patient. She is 28 years old female, and her occupation she is lecturer, and she is living with Navsari, Gujarat. Chief complaint and ocular history has come for refractive error examination and not having any chief complaint, and wants to purchase contact lens for cosmetic reason. History of glasses since 10 years. Since 10 years, she is wearing contact. She is wearing glasses since 10 years, and her current glass is 6 months old. Number no history of any ocular trauma and surgery, and she is not having any systemic illness. This is her refraction record. Her previous glasses is right eye having minus 3.5 with minus 2 at 180, and vision is 6.6 but blur. And left eye having minus 3.5 with minus 1 at 180, and vision is 6.6. This is her dry retinoscopic findings. And after a subjective correction, she is accepting new prescription is right eye having minus 4 with minus 2 at 180. Vision is 6.6, near vision is N6, and left eye having minus 3.5 with minus 1 at 180, vision is 6.6, near vision is N6. Here we can see her right eye prescription is increased by 0.5 mm, 0.5 diopter, and her glaucoma is also normal, retina equal. As we are fitting contact lens, anterior segment examination is calculated, right? So this is her anterior segment examination record. Her leads are flaccid in both height, conjunctiva are normal, cornea also clear in both sides. Interior chamber normal in content and depth. Iris is normal color and pattern. And pupil is also round, regular, reacting, no eye. So everything is perfect. Contact lens history. Patient is neophyte, as I said before. She wants to try contact lenses, cosmetic lenses, and she wants to shift from spectacle to contact lens. So we have to explain the advantages and disadvantages of contact lens, right? And also we have to explain her types, materials, and modality. Option to correct astigmatism with contact lens. Here, patient having toric prescription. Therefore, we have two options with the help of which we can correct her astigmatism with contact lens. The options are spherical equivalent and second one is toric soft contact lens. The first spherical equivalent, our patient prescription is this: right eye minus 4 with minus 2 at 180 and left eye minus 3.5 with minus 1 at 180. Spherical equivalent of this power will be, with the help of this formula, limit by 2 plus spherical, we will find our spherical equivalent. So spherical equivalent of right eye will be minus 5 and similarly spherical equivalent of left eye will be minus 4. So we can give dry lens of minus 5 in right eye and minus 4 in left eye. And the second option is we can give vertex distance corrected toric powers of contact. We should not give spherical equivalent in case of patient having more than 0.75 cm. Here our patient having more than 0.75 cm, right? Because patient may face difficulty in vision or she might get discomfort in vision. In this case, we can think to the spherical equivalent in right eye, which is having minus 1 cm. Only when patient accept this and get comfortable with this. Otherwise, we can't prescribe the spherical equivalent. But toric soft contact lens will be the better option for this case. Measuring parameters, we have to measure parameters for trial lens selection, right? So this is our measuring parameters. Our key reading is both eye having minus 40 mm at 180 and 7.70 mm at 90. HVID, what is HVID? HVID is horizontal visible iris diameter. How we can measure it? We can measure it by simple millimeter scale, measuring limbus to limbus size, both across the horizontal. So here patient's HVID is 11. Pupil size constricted 3 mm and dilated 5 mm. Lid tonicity is normal. Sherman test result is 17 mm on Whitman 41 filter paper. The normal value of this test is more than 15 mm. So we can say that Sherman test is also normal. This tear film is also normal. Now trial lens selection. For trial lens selection, measure total diameter, VOZ, that is back optic zone radius, BVP, back vertex power, and K reading, which we already mentioned here. Right? So here we will see how to measure all the parameters step by step. First of all, total diameter. To measure total diameter, we need HVID, which is we also measured, which is 11. After measuring HVID, add 2 mm to 2.5 mm to HVID and you will get your total diameter. So here HVID is 11 mm, add 2 mm between them, so our total diameter will be 30 mm. Select the trial lens according to the nearest diameter. An increase in lens diameter will tighten the fit if all other factors remain unaltered. Which means if we increase lens diameter, and we do not make changes in any other parameters, so our lens will become steep. This is because of sagittal height is increasing. This is sagittal height. A decrease in diameter will loosen the VOZ acceleration. Measure VOZ, we require keratocontrol. So our patient's key reading is this. Now we can measure our VOZ with help of three methods. First, add 0.7 mm to flattest cake. Second is add 1 mm to average cake. And third one is pro diameter flatter than average cake. So here we are using first method, that is add 0.7 mm to flattest cake to get our VOZ value. So here in our case, patient's K reading is this. So our flattest K will be 7.70 mm. First and steepest K will be 7.40 mm. Average K will be 7.55 mm. So here we are using first method, 8.7 mm to flattest. Therefore, final VOZ will be 8.4 mm. So we select the nearest base of 8.4 mm triangles. If VOZ will loosen the fit or flat fitting, this VOZ will tighten the fit or steep fitting. This is totally opposite to the total diameter. Total diameter, if we increase diameter, lens will become tight. We increase VOZ, lens will become flat. BVP. For BVP, we require back vertex distance. So anyone can please tell me what is back vertex distance? Please write your answer in comment box. Hello. Hello.
Hello, Dhyani. The question is what is back vertex distance power? Okay.
Yes. Like what is back vertex distance?
Okay. So the question is what is back vertex distance? So you can answer in the chat box. Okay, the Yash Gandhi says the back surface of lens to cornea. Then Ajuria Janisa says that distance between anterior surface of cornea and back surface of spectacle lens.
Yes. Right.
Okay.
So for BP, we require back vertex distance. Right? So what is back vertex distance? Back vertex distance is distance between back surface of spectacle lens and front surface of cornea. So here we will measure our back vertex power with the help of this formula, which is FSP upon 1 minus DFS. So here FSP is our spectacle power and D means our vertex distance. That is 10 mm in this case. So here patient prescription is right eye having -4 with -2 at 180 and left eye having -3.5 with -1. So BVP of right eye will be using this formula -3.75. So final confidence power of right eye will be -3.75 with -1.75 at 180. And similarly, using this formula, final confidence power of left eye will be -3.5 with minus 175 correct. Now, we have all the measurements like total diameter, zeta, so we select the trial lengths according to these parameters. In patient having toric prescription, right? So we have to choose the trial length axis is nearest or similar to the spectacle axis. Or the zeta is 8.4, total diameter is 30. Give the trial length to the patient and wait for 20 to 30 minutes before assessing. Once patient get comfortable, we will start our fitting assessment. So what is assessment? What points assessment includes? Assessment includes lens fit, whether it is steep or flat, corneal coverage, whether it is complete or incomplete, centration, whether it lens is centered or decentered, movement, comfort, and stable vision. So this is, you can see corneal, complete corneal coverage, and here incomplete corneal coverage. Well-centered lens, here you can see decentered lens. Okay. After assessing trial lens, in this case we found trial lens is flat. In this case, therefore we decide. Therefore, it is not well-centered and movement is more. So we decide to increase total diameter by 0.5 mm. Okay, so here the thumb rule will apply. What is rule of thumb? Rule of thumb is if diameter is increasing, the BOZR must also be increased. To offset the effect, the diameter change is on the ratio of sagittal height to the lens diameter. It means if we increase total diameter by 0.5 mm, then we also have to increase BOZR by 0.3 mm to maintain the ratio between sagittal height to the lens diameter. Okay. So increase diameter by 0.5 mm, so increase BOZR by 0.3 mm. Here BOZR value is 8.4 mm and total diameter is 30 mm. The trial length of this parameter is flat, so we decide to increase diameter by 0.5. So according to thumb rule, can anyone tell what will be our new BOZR and new total length diameter? Hello?
Hello, Dhyani, can you repeat the question?
Here, our BOZR value is 8.4 mm and total diameter is 30 mm. We decide to increase total diameter by 0.5 mm. So what will be our new value of BOZR and total diameter?
Okay, we wait for answer.
Hello?
No one is answering right now. So again, you can repeat the question, and if no one is answering, so
Simple
we can go.
question. BOZR is 8.4 mm. The total diameter is 30 mm. So we decide to increase our total diameter by 0.5 mm. So according to thumb rule, we have to increase VOZI by 0.3 mm. So what will be our new value of VOZI?
Yeah, there's two answer come up now. Nirali Durajia says 8.7 mm BOZR and 13.5 mm total diameter TD. Ivani Kansara said BOZR
Yes.
8.7 mm total diameter 13.5. Almost answer is come up like that.
Okay, it is right. So our new diameter will be 13.5 mm and VOZI will be 8.7. So we will insert a new trial length of these parameters and we will do assessment again. Now, trial length of these new parameters is perfect for this patient and it shows ideal fitting characteristic. What are the ideal fitting characteristics? Ideal fitting characteristic is lens should be centered well, corneal coverage should be complete, movement should be smooth, good comfort, and stable vision. Now patient having a description, right? So we have to do toric axis finalization. So if all above factors are fine, then axis finalization will be done. For axis finalization, concentrate on three laser guide marks at inferior or lower portion of the nose, or maybe these kinds of markings. These kinds of markings we can see in toric lines for axis finalization. So concentrate on these markings to do axis finalization. Okay. Now, toric axis finalizations, three things can happen while assessing toric lens rotation. Okay. First, no rotation or minimum rotation of 5 degrees. Second, rotation towards left hand side. Third, rotation towards right hand side. Here, this rotation is with reference to the practitioner, not the patient. Okay. Formula for toric axis finalization. Glass and cast. What it means if axis this markings is rotate towards left hand side, then we have to add the amount of rotation in spectacle axis, not in trial lens axis. We have to add this amount in spectacle axis. And if these markings are rotate toward right side, then we have to subtract the amount of rotation in spectacle axis. Similarly, if our axis rotate toward clockwise, we have add the amount of rotation in spectacle axis, and if axis rotate toward anti-clockwise, we have to subtract the amount of rotation in spectacle axis. Do not make change in trial lens axis. Remember this. First case 1. So no rotation or minimal rotation of 5 degrees. Here we can see there is no rotation of markings. So hence prescription will be same. Right eye minus 3.5 with minus 1.75 axis will be same. No changes in spectacle axis. With VOZ are 8.7. Second case, if rotation towards left hand side by 15 degree in one or both eye with reference to practice, here we can see marking is rotated towards left hand side by 15 degree. So we have to add 50 degree in spectacle axis because left and right substance. So here marking is rotated toward left side. So we have to add. So add 15 degrees. Therefore 180 plus 15, it will become our new axis, that is 15 degree. We use it at 8.7. Case 3, rotation towards right hand side by 10 degree in one or both eye with reference to practice. Here we can see lens is rotated toward right hand side. So we have to subtract 10 spectacle axis. So so here our description new axis will be 180 minus 10. So our new axis will be 170 degree. If lenses fitted well, so access quick return to access if lens mislocated. If lens will tight, slow return to access if mislocated. Lens will lose fit. Lens orientation is unstable and inconsistent. Things to remember. As I said before, do not make any changes in trial lens axis. Only we have to change in spectacle axis. Choose trial lens axis same as spectacle axis or as close as possible. Like the trial lens, final lens will also show similar rotation. Here, the trial lens is not rotating. In this case, the trial lens is not rotating in both sides. Therefore, axis will be same as spectacle axis. So, the final contact lens will be right at minus 3.75 with minus 1.75 with 180. Axis will be same. Left eye is minus 3.5 with minus 0.75 at 1. New VOCDR is 8.71 and total diameter is 13.5. Yeah, our patient is first time, right? She wants to try contact lens. So therefore we can suggest monthly disposable lenses. And if patient is not ready with monthly disposable lenses, then we can suggest bi-weekly or daily disposable lenses. Right? These are some products for daily disposable lenses. Change provides acute oasis 1 day for astigmatism, which is silicone hydrogen lens. 1 day acute moist for astigmatism, which is hydrogen lens. Supervision is providing clarity 1 day toric, which is silicone hydrogen lens. By-day toric, which is also silicone hydrogen lens. Alcon provides daily Aqua Comfort Plus toric, which is hydrogen lens. In my they provide equibiosis for astigmatism, which is silicone hydrogen lens. Monthly soft toric contact lens. Version Long provides Version Long Ultra for astigmatism, Pure Vision 2 for astigmatism. Both have silicone hydrogen lenses. Soft lens toric, which is hydrogen lens. PV2 toric, which is silicone hydrogen lens. J&J provide AQV Vita for astigmatism, which is silicone hydrogen lens, and People Vision providing Avira Vitality toric, which is also silicone hydrogen lenses. Silicone hydrogen lenses will be better option for this case because it is providing more. It allows more oxygen to pass through the material and keeps hydrate cornea throughout the day compared to hydrogen lens. So after showing all the availability of products, here our patient selects monthly disposable soft contact lens from Motion Log Vision 2 for astigmatism, silicone hydrogen lens. Now patient is first time learner, right? So we have to taught her how to insert the lens and how to remove the lens properly. So ask her to insert the lens and remove the lens in front of you for 2 to 3 times. And once she gets comfortable with insertion and removal, we can tell her about care and maintenance because care and maintenance is also most important factor for contact lens. So her instructions regarding cleaning, disinfecting, and rinsing. We can tell her to clean lens properly every time she removes the lens or insert the lens. And also tell her about complications which may occur if she will not take care and maintenance properly. So what are the complications which may occur? Principal cause for complications are inadequate lens to cornea fitting relationship, insufficient contact lens oxygen transmissibility, the presence of pre-existing ocular pathology, interference by environmental factor, intolerance of contact lens material, poorly maintained contact lens, as I said before. Care and maintenance is first. Contaminated contact lens cases. Also, tell her to change her contact lens case monthly and also clean her contact lens case. Okay. Complications are corneal infections or ulcers may occur, acute red eye may occur, high sensitivity reactions, corneal neovascularization, giant papillary conjunctivitis, or corneal edema may corruption will not take care and maintenance proper. Now, we have final contact lens power, which product which patient wants to buy. So we will order the lens. Once we get order, we have to verify the order. Because verification is first before handling it to the patient. So verification includes company products, total diameter, UZR, and lens power. Lens power we can verify by using lensometer. So after verifying the lens is ready to give the patient. Keep calm and wear contact lens because your vision your eye. Now everyone have question.
Okay, so it was a wonderful presentation, Dhyani, and I think audience are totally engaged during this session. They are stick to the session. So, okay, so now we will move to our discussion part. So we are waiting for some minute to question.
Okay, just
Yes, one question is come up. Parth Panchal, does contact lens causes light sensitivity?
no if you take care and maintenance proper.
Okay.
Okay, Dhyani, so that was a very wonderful presentation which was been explained by you, and the topic which was on the Toric contact lens as a case presentation. This is just to inform, or this is to have a quick understanding about the fitting aspects, and she has already covered most of the points. One thing I think we need to one see, which is, once we have seen the fitting, if you have seen the fitting, if it is a flat or a steep, I am giving an example, if it is a flat or a steep, then in that case we don't have to change both the parameters, that is base curve and diameter. We have to either change base curve or diameter. So if it is a flat lens, then don't change both the parameters. If it is a steep lens, don't change both, either of that, either a base curve or a diameter. The rule of thumb is mainly, if you it's only to understand whether what we should change and in how much level. And second thing is, if there is a same fit, if I want a similar fit, a optimum fit, but the lens diameter is smaller, then we need to change both the things, the diameter also to be changed and the base curve to be changed. So if we are looking on the troubleshooting level, then we have to look these points very carefully. Another thing is, when we talk about the product details, we should be giving a representation from a practitioner's point of view. It's not the patient should select, it's we should recommend them what is the best product for them. So thinking on that level, I think we should recommend them and which are the first, second and third options for the patient. And giving them an options of different companies will not be a better choice, because we are the one who looks their eyes and we will be able to share them what exactly we should recommend. So that, I think that should be been seen while looking into the Toric contact lens or any product dispensing. Okay.
Okay.
So there was another question, I think, Jasmine, you can read it.
Yes, yes. There is another question of Path Panchal. Wearing lenses for prolonged periods can lead to corneal ulcer.
You can't sleep with contact lens. You have to remove contact lens before sleeping. Otherwise, or if you take care and maintenance properly, uh, there is no chance to occur corneas.
Okay, so I think Path Panchal have get the answer. Anything else from audience?
Yes, I think it is done. So thank you, Dhyani. Jasmine,
Thank you.
you can just
Yeah.
finish the
Yes, yes.
last segment.
Okay, so I think that's all on the discussion. So once I would like to thank you, Jani. We are done with our question answer session. On behalf of Harijot team and our audience, I would like to thank you for sharing your knowledge and for this informative presentation. And also thanks for our audience being supportive as well as interactive and attentive. So,
Thank you.
Jani, so
I'm
any feedback
grateful
from
to
your side for this session?
I'm grateful to Harijit College faculties to give me this golden opportunity to speak in this platform. So thank you very much, Nirav sir. Special thanks to Nirav sir and Pooja Didi to guide me to make this PPT. Thank you so much. I would also like to thank my friends, teaching and non-teaching staff of the college, and also my family. Thank you very much.